We're going to look at fractures. Okay, for starters, the fracture is either going to be open, which means it breaks through the skin, or it is going to be closed. Okay, so there's either an open fracture or a closed fracture. Closed fracture means the skin was not broken. An open fracture is also known as a compound fracture. Okay, there's 3 grades for a compound fracture or an open fracture, and that would be grade 1, grade 2, or grade 3. Okay, a grade 1 is simply a small open wound, so the bone is broken and piercing through the skin, but the opening is small. A grade 2, the open fracture is a medium-sized open wound, and by definition measuring more than 1 centimeter. And then a grade 3 open fracture would be severe, okay, large and severe. One thing that you're worried about with an open fracture is infection. Okay, fractures also have different names depending on the nature of the fracture. Okay, for example, let's start with this one. A simple closed fracture means that the bone was broken into 2 pieces, a pretty clean break. Okay, so it's a pretty clean break, and the bone was broken into 2 pieces, so therefore we have a simple fracture. It's not piercing the skin, so you could also say this is a closed fracture. Okay, here's another example of a simple fracture where the bone was broken cleanly into 2 pieces, did not pierce the skin. And then here we have a compound fracture where the bone did break and it pierced the skin. Okay, also known as an open fracture. Okay, there are also pathological fractures, and what that means is the bone is diseased. And as you can see here, the bone is diseased. This looks like a giant cell tumor, so in other words, cancer. And that does weaken the bone. And so if you get a break through the pathological site, they call that a pathological fracture. Okay, a longitudinal fracture is where the bone breaks with the long axis. A spiral fracture means the bone twisted and caused the bone to break, so that's your spiral fracture. Okay, a green stick fracture is typically a youth fracture, because what happens is the bone will bend and then there will be a little bit of breakage, but not all the way through. Okay, so the younger you are, the more cartilaginous the bone, so as a result it bends, and if that's the case, then it's called a green stick fracture. Okay, an oblique fracture is if the bone was broken obliquely. A comminuted fracture is fragmented or broken into 3 or more pieces. Okay, up here there's another picture of comminuted, where you can see the bone was fragmented or broken into 3 or more pieces. Okay, that's called comminuted. Okay, a transverse fracture is another way to describe a bone that broke in the transverse plane. Okay, keep in mind if you view anatomical position of a person and you go this way with your line, your imaginary line, that's in the transverse plane. Okay, yes, this would be a simple fracture. Could also say a transverse fracture or a simple transverse fracture mid-shaft on the femur. Okay, as far as radiology language is concerned, every radiology report is different uh, because it depends on the personality of the radiologist writing the report. Some are very descriptive and they use a lot of modifiers. Some are not very descriptive and they use very few modifiers. Um, so at some point, I'd imagine that you all will read different radiology reports as you read patient charts. So you're going to come across some of this language with how they describe fractures. Okay, so simple fracture, comminuted, so broken into 3 or more pieces, and there's an open fracture. Okay, your first rule of reading images, so X-ray, MRI, CT, ultrasound, your first rule is, what am I looking at? Okay, what am I looking at? All right, so in this picture, what are you looking at? Okay, the answer is, well, this is a wrist. Okay, and this is the radial bone, and this is the ulnar bone. And so you're looking at a forearm and a wrist. Okay, also you'll notice that there's 2 pictures. Okay, you want to always take opposing views, which means 2 or more views in different positions. Okay, you'll notice that in picture 1, the bones are parallel to each other. So that would be an A to P view, so anterior to posterior view. And this is a lateral view on picture 2. Okay, you'll also notice that there's the break. The break is more visible in picture 2 than picture 1. Although you can see the fracture right there, it's just more pronounced in picture 2. So this is one of the reasons why you take opposing views, because believe it or not, on an X-ray, you may not see it. So that's why you take different views. Okay, a Coles fracture. Now, sometimes fractures are named after the ortho person that talked about it years ago, wrote about it, and all that. So sometimes one word, like Coles, describes sentences of different fractures. So in this case, if you fall with an outstretched hand, so the hand is an extension and the bone breaks, that's the mechanism of injury, the fall with the hand in extension, then it's called a Coles fracture. Okay, and when you say just that one word, Coles, the person knows exactly what's going on at the wrist area. Okay, a Smith fracture is the opposite of a Coles fracture, and this is where the wrist area breaks with the wrist in flexion. Okay, so this position right here is flexion. And you can see the displacement of the bone. Okay, so that's a Smith fracture. Okay, an inversion fracture is when the ankle goes in inversion, as you can see here. By the way, the other way, if the ankle went the other way, that would be eversion. Okay, but in this picture, it is showing inversion. And the force was great enough to break the bones at the ankle area, so an inversion fracture. Okay, this one actually focuses on avulsion fractures. Okay, you do not have to know all these different types. I just want you to see what an avulsion fracture is. In this example, the avulsion fracture is where the ligament, okay, the ligament did not break, rather it pulled a chunk of bone off of itself, okay, as you can see there. Okay, pulled a chunk of bone off of itself. That's called an avulsion fracture. Now this happens to be the ACL. So instead of the ligament itself snapping, it just chose to pull a chunk of bone off of itself. Okay, here's another avulsion fracture so this is the fibula bone. Okay, that makes this one the tibia. Okay, for slang, we like to say tib, fib. Okay, but for class and on the test and stuff like that, use the full word, so tibia and fibula. But just also know that in a clinical setting, it's not unusual for people to use the slang like tib, fib. Okay, in this case, the proximal area of the fibula is got the lateral collateral ligament, so that's the LCL, pulled a chunk of bone, okay, off of itself, so that's an avulsion fracture. Okay, so here's the x-ray. All right, we'll call this one picture 1 and that one picture 2. If you notice in picture 1, can't really see much, but in picture 2, the fracture is pretty obvious, okay, right there with the avulsion fracture. Okay, a pathological fracture. So, well, let's go back to what am I looking at? So this one's a knee. And then this one, what am I looking at? This would be just giving you a second to find your answer. Okay, this would be a shoulder. All right, so this is the humerus bone. Here's your clavicle. There's the scapula. Those are ribs. Okay, so again, when you're looking at imaging, the first rule is, what am I looking at? Okay, so in this case, you'll notice that the bone here has a bunch of what looks like holes in it or some lesions. All right, so if you notice, like right here, and by the way, there's a fracture and there's a fracture. If you also feast your eyes down here, I'll do it in red. This bone has a nice, healthy, thick cortical margin. Okay, the medullary cavity looks really good. But as you move your eyes up this way, you'll notice that the medullary cavity changes. Looks like there's just a bunch of lesions in there, so that is diseased bone. Okay, so therefore the fracture through this diseased bone is a pathological fracture. Okay, there's another fracture up there. So 1, 2, 3 breaks, it looks like, from this film. Okay, what am I looking at? So this is a shoulder, and this is the clavicle. And as you can see, the clavicle is broken about mid-shaft. Okay, here's a comminuted fracture. So this is also a shoulder, focusing on the clavicle, broken in multiple places. And something like that would require surgery. Okay, here's a trick question for you. If you break a bone and do nothing to fix it, does it heal? If you break a bone and do nothing, will it heal? The answer is yes, but it will heal incorrectly. Okay, so the best thing to do in this case would be to pin it. Go in and reconstruct it, and some surgery, and that would straighten it out and fix it. Okay, in this picture, this is the lower leg. So this is the tibia. This is the fibula. Okay, this would be the ankle area. Okay, and you can see that both the tibia and the fibula broke. Okay, another type of fracture is a uh, stress fracture. And I call this the paper clip analogy. So if you took a paper clip, which looks, I guess, something like that, and you stretched it out, so now the paper clip is open, and you keep bending it. Okay, so let's say that's the area that you're going to bend and bend it one way, bend it the other way, and you keep doing that. What eventually happens to the paper clip is it breaks. That's a stress fracture. You kept stressing it by bending it over and over again. And so in this example, in the foot, specifically the talus, so that's one of the bones in the foot that we'll cover another time. The constant up and down, so dorsiflexion is where you go up with the foot, and plantar flexion is where you go down with the foot. That is the walking or running action, constantly going up and down with the foot. Plus the impact over and over and over again can cause a stress fracture. Now, any bone in the body can experience a stress fracture. It's not just a foot thing, it can be anywhere in the body. Okay, one of the things that contributes or increases your chances for getting a stress fracture in the foot is abnormal biomechanics of the foot. Okay, right here is normal. Okay, this is your safe range. So if you look at a person's Achilles tendon area, look at the back of their foot, and they have a little bit of pronation, it's okay. If they have a little bit of supination, it's okay. Ideally, you want the foot to be in a neutral position. Okay, a lot of people actually are in this position here where they overpronate or oversupinate, and the overpronation is the more common. And the best thing to do to help this is orthotics, right? So a shoe insert, an arch support, orthotics. And what orthotics will do is it will take you from this position, overpronation, and move you more neutral, improving the biomechanics of the foot, which reduces your chance of plantar fasciitis, foot pain, stress fractures, and so on. Okay, so I see a lot of foot injuries and, plantar fasciitis, stress fractures, stuff like that. And it's very common to see some form of overpronation that contributes. Okay, in this case, there's actually a stress fracture to the tibia. And you can see the little like white fuzzy part of bone. That's letting you know that the bone is irritated and therefore a stress fracture. Okay, here's another one, the foot. Okay, this is a foot. So this would be your big toe, known as the hallux. And that is actually metatarsal number 1. And then here's the one that I circled would be metatarsal number 2. And you can see that fuzzy area in bone, so that is where the stress fracture is. Okay, you also get a nice history. So in this case, the person was, I was training for, this 10K, and, my foot started hurting with all the training that I was doing, started walking with a limp, kept pushing through it, and now my foot is swollen, hurts, and that kind of thing. And so you get an x-ray, it's like, oh, you have a stress fracture. Okay, then treatment would be simply to put them in a fracture boot for let's call it 6 weeks, something like that. Everybody's different with healing time. Depends on the severity of the injury and how old or young the person is. Typically, the younger you are, the quicker the bone's going to heal. The older you are, the slower it's going to heal. But so let's call it 4 to 6 weeks. They'll be in a fracture boot, and then you can reevaluate after that to see if you can wean them off of the boot or if it needs to stay on longer. Okay, the healing of fractures is done in 4 phases. Uh, Part 1 or phase 1 is the hematoma formation. So this is where the injury just happened. Okay, so you fell off the bike, broke the arm, right then and there. That's where the injury happened. Okay, so that would be acute, and you're going to get bleeding and pain and inflammation. Okay, bleeding, pain, and inflammation. So that's your hematoma. So bleeding into the area. Okay, each of these phases is about 2 to 3 weeks. Okay, so 2 to 3 weeks. And that will give you 8 to 12 weeks. So most, let's say, common, normal, everyday fractures, you're looking at 8 to 12 weeks. Okay. Now, the reason why I say it that way is some fractures can be nasty that need multiple surgeries over a long period of time, and then lots and lots of rehab. So, like, for example, a motorcycle accident where the leg fractured so bad that they wanted to amputate it, but decided to keep the leg and see if they can save it. And so you're looking at multiple surgeries over a long period of time. So that's not going to heal in 8 to 12 weeks. You know, you're looking at a year plus of a lot of work and therapies and stuff like that. Okay, so that's what I mean by kind of your everyday fractures. You know, you're looking at 8 to 12 weeks. Okay. In part 2 there, that's the fibrocartilage and callus formation. Okay, so that's in a way a type of scar tissue that's coming in. And it's also laying the foundation for the matrix so that the body can start to deposit calcium and other minerals back into bone to re-solidify it. Okay, so that puts us to part 3, the bony callus formation. And osteoblasts are at work, and the osteoclasts are at work, right? So blasts build and clasts break down. So you have a lot of fragmented bone, and when bone becomes broken and fragmented, it starts to die off, so your body will get rid of it. Okay, it'll smoothen it out and that kind of thing. So that's that's the clast. The clast job is to break the bone down, it'll smoothen it out, and then the blast is going to build. And then in the fourth part with bony remodeling, calcium comes in, keeps getting deposited into the matrix, and the body keeps smoothing out the bone over and over again until it heals. Now, the actual remodeling part can be up to 2 years. Okay, now at week 8 to 12, the bone, you know, you're cleared to go do your sport or whatever, get the cast off, that kind of thing. Okay, but it's not necessarily, you know, let's say at week 8, everything is 100% and ready to go. Even though the fracture is healed, let's say by week 8 to 12, there's still a lot of remodeling to do, and that can actually last up to about 2 years.